Dr. Nikhil, is there any ideal screening methodology or a screening schedule for men to screen out for prostate cancer? Like just how for women we have the breast examination and how a screening is done once a year. Is there any protocol like that for men?
There are protocols, but these are mostly practiced in the Western worlds. Currently in India, we probably, I would say, extrapolate what the other countries are doing for in the Indian context. However, there are a lot of pros and cons, and I'm very, very open about it. If you look at the Western, they will typically recommend from the age of 55 till 69 annual PSA testing, which is normally done for Western countries like US and all that. In India, one may recommend those tests, but after a thorough discussion with the patient, because every test comes with its own baggage. When I say that, it means that the normal healthy individuals, when you are subject to the testing of PSA, there's always been a lot of anxiety. What's going to happen? Many a times we come across reports which are false positives, falsely high, and then that leads to further anxiety. If the numbers are slightly on a higher side, even though there may be a disease, let's say, try and understand the prostate is a very slow disease. So whether we do a lot by picking up at a very early stage or we change the entire course of the things, the science is yet to give that correct answer over to us. And when you do this test, you end up doing more investigation, you end up doing more surgeries, more radiation for a very early stage prostate cancer, where anyway their longevity would have been the same, and you eventually end up giving a lot of adverse effects related to that, like again erectile dysfunction, urinary incontinence. Somebody has to bear those problems. So there are always two sides of the story. So in India, what we do is what we call as opportunistic screening, where on an individual basis, if you come across that particular age bracket individuals, or somebody may have some risk of some cancer in the family, then there has to be a very open discussion with the patient why the test is being done, what are its implications, and what are its possible consequences if the test comes positive. And after a formal discussion with the patient, then the test can be offered to the patient, so that it is more of a, I would say, informed decision making is what we should be doing for the prostate cancer, to pick up prostate cancers at an early stage, because screening is meant to pick up the cancer at a stage where you can treat early, so that it can change the outcome of the patients.